Getting older happens to all of us, but pain shouldn't happen to us. If you're living with constant pain due to knee arthritis and had that diagnosis confirmed, if you've exhausted all other options for management of pain, why not consider knee replacement surgery? It's successful surgery, it's safe surgery, and knee replacements nowadays last a lot longer than you may expect in comparison to knee replacements in the past. There's usually an option available to you if you have pain, and there are many non-surgical treatment options available to you before having to consider knee replacement surgery, ranging from very non-invasive hands-off treatment, including physical therapy, lifestyle modification, weight management, ranging then into less invasive procedures such as injections into your knee. And there are many types of injections available to you, and I'd urge you to seek advice of which injection or injections are best for you in your circumstances from an expert. And then finally, there are surgical options. And knee replacement, in general terms, is a very reliable, established, and reproducible option for patients to consider safely. If you're experiencing bad knee pain, talk to your GP, talk to your physiotherapist, arrange an assessment, which will probably include an X-ray, and following that, a decision will be made on whether you need to see an orthopaedic surgeon or an expert.